Every person that comes through this space has a conversation with us. We talk about their life, we talk about their experience, the problems, we talk about the highlights, we talk about their mental health. The people that we end up recruiting are normally the ones that are on the edge, normally the ones that have got mental health issues, that are suffering from depression, that have anxiety issues, but we've managed to work with those people to move them on to normal lives outside of our environment. There are more of us working together. That works across any business, any idea. One voice, shared ethos, works better, health, happy, smiling, strong, fit. To me, it's simple. If the NHS could find a way to do that through developing more relationships with organisations like this, and then let's master the art of it and then move that out.
What is really, really clear from all of the research is that people get better care and they get better healthcare where we work in conjunction and collaboration.
We have a real opportunity to do something very, very special for the people of Kent and Medway, but for the people who work for NHS Kent and Medway.
We all know there are huge needs in the county. There is a big backlog for the NHS across the country. We face continuing demands on social care as well. And I think what's really important is that we bring our resources together, deliver those as effectively as we can, because that is the only way in which we're actually going to be able to provide the services that people in Kent and Medway need and deserve.
All local authorities have got a pivotal role in this new infrastructure to support our NHS, to support our populations. We work at place levels, so whether tackling issues around housing or employment or welfare, local authorities bring a very strong focus on place and people.
How we deliver health and care in Kent and Medway needs to change. The Kent and Medway Integrated Care System brings together NHS organisations, councils and social care providers to deliver care in a more joined-up way. Together, we will improve population health and care outcomes, tackle the inequalities or reasons why people have poorer health outcomes and experiences, and struggle to access the care they need, enhance productivity and value for money, support broader social and economic development.
In terms of the people that we serve in Kent and Medway, the 1.9 million people that we serve in Kent and Medway, at different points in their life, they're going to need different things. And it's about having the right skill set and the right health professional who will interact at that point with that citizen. So the challenge for us, but it's the challenge that I think is the right challenge, is that as we form the Integrated Care Board, we bring the parts of the system together to be much more cohesive so that it doesn't feel as a citizen that you are going through a fractured and disparate system.
NHS Kent and Medway Integrated Care Board is the lead NHS organisation in the Kent and Medway Integrated Care System. Working with partners across the system, we will develop and implement a plan to meet the health and care needs of people living in Kent and Medway.
Our challenge is to respond to individual need. No two people in Kent and Medway are the same. So we've got to be person-centred in what we do.
I'm Amber Garland, and I had my stroke at 19.
Amber was an active young woman studying psychology at Southampton University when she suffered a catastrophic stroke.
My swelling in my brain swelled so much, the surgeon removed my skull to relieve the pressure. My MRI showed a massive hole in my brain. My speech, my walking, everything gone. I didn't say anything for a month. And my first words are hello and psychology.
When Amber was well enough, she was supported by a multidisciplinary team to return home.
In place was the OTs, the speech and language and physio. I had the best care possible through the care managers working together. So yeah, it's wonderful.
Amber volunteers with the Stroke Association and won a Volunteers Award in 2017.
We now have a greater understanding of the social determinants of good health and well-being, be that physical or mental health. It's housing. It's whether people have meaningful work. It's whether people are happy in their community. There are lots of factors that are outside of the NHS's control. And if we are going to maintain the success of perhaps the best health system in the world, because that's what the NHS is, we've got to do things differently.
What we've been able to do is to create these networks and systems at a local level, at a place level. So we've got 4 across Kent and Medway.
Delivering the integrated care system strategies in Kent and Medway are 4 health and care partnerships: Dartford, Gravesham and Swanley, East Kent, Medway and Swale, and West Kent. The health and care partnerships bring together hospitals, councils, networks of GPs, voluntary services, private healthcare providers and health boards such as Healthwatch, focused on putting the person at the centre of their care.
It means that we're knocking the doors down between different bits of our system. So our acute hospital colleagues, our community colleagues, our primary care colleagues, our social care colleagues, our voluntary sector colleagues, also other people who may be in that space that we commission. So you've got independent providers, they will come into that space if they're commissioned by either a local authority or an NHS organisation.
I think most of us would think it a great injustice that you can see massive differences in terms of life expectancy and healthy life expectancy across very different parts of what is the same county or the same area of Kent and Medway. And that does have, a disproportionate effect, particularly on people who have less in the way of opportunity, less in the way of social advantage. And so it is really, really important that we address that.
Healthwatch is a national independent body that champions the voice of the patient within health and care services.
I do a lot of voluntary work for Healthwatch, and through that I get access to meetings and organisations who work within both health and social care. I'm sure many people who are reliant on social care are reliant and have a health condition as well, so they've got to work together and share their load. I had 3 experiences in the last 2 months where things have been so responsive. It's the way I would like to see everything working in the future. I've had to visit a one-stop clinic, and it was exactly that. I had a consultation, tests done, results the same day, and a decision made by the consultant. And who could ask for better than that? If they listen to what the patient says and then they listen to each other, it'll make a big difference.
I want people to feel that there are opportunities to influence those services. I want people to feel that irrespective of their background, of their gender, of their race, they will be listened to. Their voice will be heard as loudly as anybody else's voice.
We often think about the things that we need to put into a place, but we need to remember that it's the outcomes that we're trying to achieve. And I would therefore suggest that we can create a better way of working by thinking about outcomes, thinking about people, thinking about the direction of travel and the journey that we want to take with our population, led by the needs.
I think that the people of Kent and Medway deserve the very, very, very best health and care. And it is health and care, because you don't get one without the other.
We know that what really makes the difference in terms of people's health, only a very small part of it is actually health and care services. So can we do more collectively to improve everything from those sort of long-term elements that really have an effect, right the way through to the service that people get, particularly actually those perhaps in more deprived areas?